Hello, everyone. Good evening. I hope everyone is ready to listen to me. Some of you may be disappointed. Hold on, I'll be right back. Yes, here we are. I want to greet each and every one of you, and I want to welcome you to Gospel Total Ministry. You may be a little bit disappointed because we were supposed to have met Antoine M. Jean for a special session on divine calendar. He is a great speaker, he's full of knowledge, and I'm sure you would have enjoyed that presentation. But unfortunately, because of technical difficulties, I am I have to reschedule. So we reschedule him for another time. But good things take time sometime to happen. So you are stuck with me. Sorry to disappoint you. So we will have a presentation on health instead because this is my forte. Sorry for the inconvenience again. As you know, our organism loves to function harmoniously. If any organ is affected by some sort of uneasiness, discomfort, our entire being feels strange and urges us to find the cause. Nevertheless, certain organs play some very important, some key role in our well being. Let's take the brain, for instance. Our brain is a complex, very important organ that controls our thought, our memory, our movements, our sensation, our emotion, our motor skills, our vision, our breathing, our language, our temperature, our hunger, and every process that regulates our body. Together, the brain and spinal cord that extends from it make up what you call the central nervous system, or CNS for short. We also heard, you've also heard about the peripheral nervous system, which consists of the nerves that branch out from the brain and spinal cord. These nerves form the communication network between the CNS and the body parts. Overall, the CNS, the central nervous system, controls the whole organism. When we talk about a mental state, we talk about the cognitive state of a person. So today I would like to speak about mental state, altered mental status. As I stated earlier, when we talk about mental state, we are talking about the cognitive state of a person that refers to one's thought processes and the state of mind which can vary widely. One's thought processes can be faulty and cause damage. Typically, our cognitive state will affect how we process information and how we behave and how we interact with others. Mental state is a state in which the quality of life, the behavior, the level of interaction of a person is constant. The state of thought, our way to perceive and to react becomes dynamic and adjusts right away to function normally as expected in our interaction with others. Mental state also depends on physical, on mental, and psychological inputs. Somehow we have a system which is so well built in us that it's able to recognize what's normal for what's not normal. Haven't you heard of people saying, this guy looks weird? I don't like this guy, strange, because of the way he behaves, of the way he talks, of the way he walks. Something is strange about him. What is acceptable, we know. What is not acceptable, we know more or less. I'm not going into philosophy saying, how do we know what's normal? I'm not getting there. When we talk about normal mentation, normal mental status, we're talking about the ability for you, for me to function, to interact responsibly as expected from someone of our age, our race, our gender, our culture, and our level of education. That's what we call normal. Anything beyond that is questionable. So based on what we call normal, we are then able to identify what's abnormal mental status. We all practice a number of means and ways to identify the mental status. The general appearance, the orientation, the way he talks, the way he walks, if he can hear, the way his gaze, how he looks at you, how you respond to painful stimuli. These are all ways for us to find out mental status. The mental status has different levels. You understand? Okay? You can be fully alert, responding to any stimuli. You can have a cloudiness of consciousness. That means you're not too ready up there. You could have a confusional state. You could have delirium. You could be lethargic. You could be obtunded. You can be stuporous. You can have dementia. You could be sleepy, hypersomnia. You could be at a vegetative state, in a vegetative state. You could be completely mute. There is a brainstem stroke called Lactin syndrome. You could be in coma. That means you are totally unresponsive. You have no response to anything. And the last thing, you could be brain dead. These are all the areas of mental status, from being normal to being completely dead, unresponsive. So the general appearance will give us a clue. So when we talk about altered mental status, we mean there is a disruption in how our brain works that causes a change in behavior, because the brain controls our behavior. This change can happen suddenly or over time based on the causes and the reasons. Altered mental status, you will hear doctor call about AMS, altered mental status, ranges from slight confusion to total disorientation and increased sleepiness to coma. Underlying causes can be as subtle as you may have just an infection, like a urinary tract infection may cause altered mental status. Or it could be a life-threatening reason, like you have a stroke, you bleeding in the brain, or you have an a heart attack. This activity outlines the approach toward differential diagnosis, your evaluation, your examination, your treatment, and what's urgent, whether or not you have to jump to address the condition. So the treatment plans for patients depends on what's going on. Okay? So we're going by age bracket. For instance, in infants and children, the most common causes of altered mental status in a baby, in a child, is infection. Or she fell, trauma, metabolic changes, toxic ingestion. You put something in his mouth. When you're dealing with young adults, most often they present with altered mental status because they were taking some drugs, they were drinking the wrong thing, they were smoking the wrong thing, or someone hit them in the head. When we're dealing with the elderly people, most commonly we present with altered mental status is because of a stroke, or they have an infection, or because they have so many medications they take together. You have what you call drug to drug interaction, or there is a change in the living environment. The elderly person is not used to be at home taking care of everything. All of a sudden, they put him or her in a nursing home, so you see him head down and he's not interacting. There is altered mental status, but it is psychological. He's not happy. Okay? In the elderly people, nearly 10 to 25% of hospitalized patients will have what you call delirium at the time of admission. That's it. The admission caused them to be restless, agitated. One moment they are nice, another moment they are very restless, and that's caused delirium. But delirium doesn't last for too long. 2 days, 1 day, 3 days, and that's it. You cannot be delirious for over 72 hours. There got to be a better reason for that. Okay? 12 to 48% of general population will experience what you would call a syncopal episode. I tell my students, my patient, my residents, everyone is entitled to pass out once in their life. But we need to know why. Because most of the time it's benign, there is no big deal. But you have to find out why. For instance, people who are in a nursing home, in a group home, whatever, who are 75 years or older, they tend to have about 6% annual incidence of passing out. Okay? Children have at least one episode. 15 to 50% of children will have at least one episode of passing out. So this is something that happens very commonly. 5% of people coming to the emergency room will complain about altered mental status. Or the family will say, family went on vacation, family was away, doesn't know dad, hasn't seen dad or mom for years. Now all of a sudden he comes. That's not the dad he used to know. He brings the patient to the emergency room. Oh, my dad has altered mental status because he doesn't know the baseline. Or the home attendant, it's a weekend, wants a weekend off. He brings the patient to the hospital saying, this guy has altered mental status because they want the weekend off. There are so many reasons we're dealing in the emergency room when people bring elderly people to the emergency room. As statistically, we could say most common cause overall of passing out of what you call syncope or altered mental status, about 50% is what you call vasovagal, just a reflection within the system. Okay, but you have to do some workup, and in 30% of workup, there will be no identifiable reason for that syncope. 17 to 18% of those cases, they are attributable to heart condition. For instance, you heard about 30% of athletes who die during their exercise, they had a syncope based on their heart condition. 3 to 5% of emergency room visits make all hospital admissions per year because of syncope. But there is a catch. There is a guideline on why you should admit a patient because of syncope. And causes of this altered mental status, including syncope, it could be depression. Depression means personally he withdraws all his activities, his speech is slow, he doesn't want to interact with anybody, he's withdrawn, he goes into his room, and you say it's altered mental status. Another cause for altered mental status is dementia. As you know already, it's a chronic change. Slowly but surely, the patient is getting there, progressive loss of mental capacity, leading to deterioration of cognitive ability and behavior. There are multiple types of dementia. We've spoken about them already. The most common are idiopathic. We don't know why. But we have Alzheimer's as number one. Then we have vascular dementia, which means a microvascular disease is causing this kind of problems. So you have slow impairment of recent memory, your orientation is not that great, and remote memory and motor, your speech, your ability is limited, but you remember remote things, things in the past, many, many years ago, but recent things you can't remember. We talk about that. And as the disease progresses, patient will increase changes. Then you have other causes. As I said, then the worst part is when the patient becomes comatose. That means there is complete dysfunction of the arousal system and patients do not respond to basic stimuli. But if they retain brainstem reflexes, there will be a few things. You would have like your pupil may be reactive. You may have some gag reflex, but that may go too in a few days based on the cause of your not being able to respond. Even in coma, there is deep coma, there is light coma, depending on the neurological response we get. Okay? So, when people have altered mental status, there is a long list of causes. If you call a neurologist for altered mental status, he's going to look for CNS causes. Okay? He's going to look for brain tumor, hemorrhagic tumor, a stroke. He's going to look for something in the brain. If you call an infectious disease, he's going to look for an infection. There are so many reasons that can cause change in mental status. Alcohol, drugs, electrolyte imbalance. If you have, if you take opioid, you have uremia, you have trauma to your head, you have blood loss, you lose so much blood into shock, intracranial infection, meningitis, psychosis, altered mental status, food poisoning, psychiatric causes, seizures, sepsis, okay? They hit you in the head. Your sugar goes down, hypertensive crisis, rapid increase in your blood pressure, or rapid decrease in your blood pressure, okay? You're pregnant, your blood pressure goes up, you may pass out, okay? There's what you used to call toxemia. Now we call that hypertensive disorder of pregnancy. Overall, when someone comes to you with altered mental status, you need to find out why. So what am I talking about? You went to work. You work hard all day. You come home, and when you come home, you're taking care of kids, you have to cook, and so on and so forth. Then you stop by in the room to see dad. You see dad is on the bed, not responding. Hi, dad. How are you? How are you? You do a lot of things. Finally, dad wakes up. Okay? So you have so many things to take care of. You just say, oh, he was sleeping. He was sleeping. Then he sits down, I'm going to bring you food. You come back, dad is not responding again. He's not responding. You got to find out why. You cannot just say, he's just tired. Don't just discount that. That could be something that you need to take care of. Okay? I'm not saying that you must jump at any condition of altered mental status, but you have to watch out because you may make a mistake. Even in the emergency room, sometimes we make mistakes. We think it's nothing when it's a big thing. So you got to be careful. You have to take care of the patient. Okay? Do your exam. Okay? And when you come with the condition, you do the test. If it's because you check the sugar. the sugar is too low, so you know it's because of hypoglycemia, you give dextrose. You check, you do a blood gas called ABG, arterial blood gas. You see that oxygen is very low, PCO2, gas carbonic, is high, by bicarbonate, whatever you call it. CO2, to a low, to a high, O2 to a low, to a bas. Donc, immédiatement, le système de hypoxia, ou capable longtemps, ou by oxygène, et pour monitorer, mais là, you have to make sure you do a COVID test to make sure it's not COVID or anything else. OK? Ou un jeune homme venu avec pupille yeux petit. Vous connaissez probablement ses drogues, ou pas étendre, vous pouvez faire drogue screener, mais au bal narcan pour make sure que il pas mourir dans mon pendant attendre. Si mon a 6 jours, au bal lorazepam, au valium, OK? Et si la si épilepsie, si 6 jours là, c'est à cause, if 6 jours is because of hypoglycemia, you have to give him some kind of dextrose. If the patient is very cold, you give a warm blanket. Okay? Now, the main thing I would like to speak about for the remaining 5 minutes is what the real true cause of syncope. Syncope generally is characterized by a transient loss of consciousness. Transient, that means you pass out, your whole tone is completely gone, and your blood flow decreases from your brain, so you hit the floor to reestablish equilibrium, then you get up. You come back right there. So this is called vasovagal syncope. Fainting occurs when the body overreacts to a trigger. Something happens, and young adults and children, most often, it can happen to anyone at any age, but young adults happens a lot of time. Men and women experience that equally. It's usually harmless, does not require treatment, does not signal an underlying condition in the brain or heart. However, you need to do the workup. You cannot just say, that's nothing. You need to do the workup. If you keep having future episodes, so you got to know, first of all, you have to find out what you're doing. Every time I get up too quickly, I feel dizzy and I pass out. So learn how to get up slowly. You have to find out the reason. Every time I am under pressure, every time I don't sleep, every time, so you know the causes for the fainting spell, so you take care of it. Okay? And if they find the cause, they may give you some medication. But the main thing is you pass out when there is a rapid recovery of your consciousness without anybody having to resuscitate you. It could be because the reduction of blood flow. You stand too quickly, your heart didn't send the blood flow up there fast enough, so you passed out, you fall, and after you fall, the equilibrium is restored, then you go back, you're okay. Okay? There are a wide range of causes, but you need to rule out any life-threatening causes. The prognosis is generally good if the cause of syncope is not a cardiac disease. Okay? If it's a cardiac disease, you need to address it. If it's seizure, epilepsy, you need to address it. If it's a cardiac syncope, you need to address it. If it is a stroke or you have occlusion of the blood vessels, you need to address it. Okay? If it's low sugar, high sugar, address it. If you tend to hyperventilate, you get anxious, you breathe too quickly, too fast, you need to address that. Okay? If you don't drink enough water, sometimes I had a patient, each time he put his collar too tight with the tie. He put a tie, he wears ties, If it's too tight, he'll pass out when he turns his head. So that's vasovagal, vascular maneuver. He goes after walking very fast, then he goes to pass urine, he can pass out. Or some medication may cause you to pass out. There are many causes, as I say, you need to find out why. Not you, your doctor need to find out, do the workup, then you can decide. Okay, so the key thing I want to point out to you is you have to make a difference between a seizure and a syncope. Okay? Syncope, c'est syncope. What is syncope? Syncope is the fact that you lose your consciousness, you pass out. Okay? So just mere syncope, that means you pass out momentarily. You may feel nauseous. You may have trouble. You may be hyperventilating. Okay? But once you get up, you are awake, you are alert, and everything is okay. Okay? But if you sit too long and you have congestive heart failure, you have coronary artery disease, and you pass out, we need to address this. So it depends on how healthy you are. So fainting is passing out, syncope, whatever you want to call it, is very specific. Remember that. It lasts for less than 1 minute. You may have some jerking movement when you hit the floor. You pass out. Your vision becomes dim, slowly decreased. Your pupils are dilated because you're wondering in a few seconds, what's happening to me? Your pupils are dilated. You feel dizzy. You feel nauseous. You have cold sweat. If your skin is pale, then you pass out for a few seconds. That's what we call fainting. Now, when do I talk about seizures? Seizures, if you have a history of seizure, then you pass out, the first thing I think of is seizure. If you bite your tongue when you pass out, definitely, absolutely, most likely seizures. Okay? If after you passed out, more than 5 minutes, more than 3 to 5 minutes, you passed out, then I wake you up, you're confused, you don't know where you are, that's seizure. If when you passed out within five minutes or so, you urinate on you or you do number 2 on you, that's most likely seizures. And before you have seizures, you feel something. Either you smell something, either you see yourself somewhere. That's what we call aura. Okay? Then when you get up, you're confused. You have incontinence of urine. Okay? Then when you pass out, you have some jerky movement. So don't forget. Let's review that. Seizures have some specific sign. It will last longer than 1 minute, whereas syncope, fainting is less than 1 minute. Seizure is more than 1 minute. Seizures, you have loss of bladder or bowel control. You pee on you, you do number 2 on you. Not always, but that can happen. If that happens, I'm sure it's a seizure. You bite your tongue. If that happens, I know it's a seizure. Your whole body shook when you when you passed out. That's called convulsions. That's seizures. You have some involuntary jerking movement. That's conversion. Your lips were smacking. You are chewing, biting your tongue, drooling. Your eye were going all over the place. You're staring into the space. All these signs are telling me this guy has seizures. But bear in mind, diagnosis of seizures is not easy to be done. So sometimes you need to see the neurologist so he can evaluate you and tell you whether or not you have seizures. There is also cardiac syncope, sudden and without put any sign. You pass out, then they do the workup. They find out you have obstruction of blood flow. Your aorta is occluded. Okay, you have pulmonary hypertension. Your heart rate is not rhythmic, is not regular. Okay, you have a lot of things. Ventricular tachycardia. I don't want to give you all these big words. But for syncope, one episode I cannot accept. But more than one, you need to find out why. But syncope can occur at any age. Okay? But if you have syncope after age 40, you got to do a workup. You got to find out why the patient is passing out. Okay? So don't forget, all these things are very important to find out, because if we miss one key thing that's treatable, then you're going to misdiagnose the patient, and the patient may die. You will be held responsible. So it could be a TIA, okay? TIA, transient ischemic attack from your brain, especially TIA from the brain causing passing out is usually from the brain stem, from the back of your head. As I know, I think I said that before, but we have two sources of blood flow. One from the front is called the carotid arteries, and the back is the vertebral basilar circulation that brings that feeds the whole back of your head. So if you have any occlusion in the back of your head from the vertebral basilar artery, boom, you may have what you call drop attack. Okay? So that means you need to do workup. So you take the history to find out what's going on. You evaluate the patient, okay? Events before, events during, event after. I mean, what happened? What happened before you pass out? Oh, I was having a party. I drank a lot of alcohol. I didn't sleep for 2 days. Then I know you deserve it. You must have done something wrong. So I will take you seriously, but I will ask you, stop that drinking, cut down on that. You need to sleep and address those issues, because you can address them yourself. Okay? And I also have to check your medication, especially in elderly people, elderly population. Okay? Then I would ask, is there anybody around to see what was going on and what happened after you passed out? Do my exam, do some tests, chest x-ray, EKG, ABG, do all the tests, blood tests, CBC. I don't have to give you all these words because you may not understand them. But the doctor knows that he has to do some workup. But there are some reasons patient may come to you and have no symptom when they come, but you may still have to admit them, because there is a rule that physician must make a decision to admit for syncopal episode. If the patient is over 45, okay, you will sound, they call this a patient with a high risk for a serious outcome. So it requires admission, okay? If you have a systolic, the big number, big systolic, the small number diastolic. If your big number is less than 90, you got to be admitted. If you complain of shortness of breath, you have to be admitted. If you have a history of congestive heart failure, you have to be admitted. If your blood hemat count is less than 30, you have to be admitted. They do an EKG for you. That means to read your heart rhythm, and it's irregular, it's not kosher, you have to be admitted. They do an ABG, the ABG is bad, you have to be admitted. Okay? So that these are what, when you ask, why are you admitting my father? But there are signs we cannot take chances, we need to admit the patient. Okay? So in a review, we need to make sure we find out why you pass out, and we need to do the examination, the test, and we need to treat you based on what's going on. And that's about what we're talking about. We want to rule out the causes and address it. Thank you very much. Maintenant, and now I'm going to speak in Creole French to make sure my friend understand. Bonsoir à tous, toutes mes excuses parce que nous devrions avoir Maître Antoine Jean, un éminent et orateur, comme je disais tantôt, une encyclopédie ambulante, mais pour des problèmes techniques, nous pas qu'à gagner aujourd'hui, mais ce n'est que partie remise. Alors, je voulais profiter de cette occasion pour parler de l'état mental altéré, altered mental status. Sont perturbations du fonctionnement de votre cerveau qui entraînent un changement de comportement. Vous entendez, oui? Un problème dans le cerveau a fort un changement de comportement. Ce changement peut se produire soudainement ou sur plusieurs jours. Ça dépend de cause là. L'état mental altéré, son présentation courante. Son bagage nous joignent souvent, mon pas normal. Vous regardez, ou ce travail, ou entre la caillou, et pour où les paix un petit peu confus, la machine en canal, pas même comme ça l'a fait, ou elle l'a dormi, ou elle va manger, elle va pas manger, gon bagage qui a passé, ou besoin qu'on ait ça qui a passé. Ça relève son état mental altéré. Donc, il faut identifier la cause sous-jacente et pour fournir les soins appropriés pour réduire cause, chance pour la tomber pipe pour mourir de non avant l'heure. Donc, il faut prendre précaution. Le diagnostic différentiel est large et les prestataires de soins de santé doivent être conscients de cette étendue. Donc, ça fait dépourvu pour nous un bon test pour nous faire avant nous voir la caillou. Ou dit ça ok, mais papa non, non, il y a des tests pour faire, pour capable connaître pour qui ça mon nom pas perdu connaissance ou bien pour qui ça état mental changé. Ou capable de délirium, on état confus, arrivé rapidement et en altération de l'attention ou bien ou pas qu'à connaître qui loyer qui boyer ou pas même reconnaître famille un moment où très très doux, un autre moment très agité, non, ça son bagaille pour ADC. Délire là capable généralement pour grand monde ça causé par à cause de infection ou bien li boit trop alcool, li vinn gen délire. Ou gen dépression côté ou pour une raison quelconque qu'on pas content, là ça yo ou gon mal-être. Donc, vous ne pouvez pas vous pas manger, vous ne pouvez pas baigner, vous ne pouvez pas l'amour, vous ne pouvez pas socialiser. Ça, c'est la dépression pour vous adresser. C'est capable de démence. Nous parlons de démence qui ont perte lente et progressive des capacités mentales, qui entraînent une détérioration des capacités cognitives et du comportement. Il y a plusieurs types de démence. Nous parlons de tout ça déjà. Nous dit parmi les plus communes, nous avons Alzheimer, number one, qui est presque 5% de la population, et nous parlons de microvascular ischemia, et accident cérébral causé par les petits vaisseaux sanguins qui ont l'autre cause qui a causé dementia. On l'autre bagarre encore, il y a les troubles cérébraux, hémorragie, stroke, tumeur. Donc, niveau de conscience là dépend. Ou capable alerte quand on va répondre à tout ça qui a passé, ou capable de obscurcissement de la conscience, ou de bon état confusionnel ou confus, ou capable de délire, ou capable de léthargie, ou capable de stupeur, ou capable de démence, ou dormir en pile, état végétatif, côté ou un syndrome d'enfermement, ou un coma, jusqu'à ce qu'on vienne ou pas répondre du tout. Absence de réponse, la personne ne montre pas de réponse du tout, ou vient gagner la mort cérébrale, ça relève la caille aux États-Unis, brain death. OK? Diagnostic différentiel là très vaste, mais les nourrissons, les enfants, les ont gagné changement de altération de mental, les plus fréquentes causes c'est infection, ou bien le tomber, le trauma. Un changement métabolique dans le blood test ou bien li valon bagay qu'il pas de valer ou bien une substance toxique ou bien li gon bouton dans gorge li qui empêche de respirer bien soit adresser ça. Maintenant, jeunes adultes, le plus souvent, les mentales altérés, c'est parce que ils prennent un bagage qui est toxique. Ils prennent drogue, ils bon bagage, pas de bois, ou bien ils tapent pas dans le monde, ils frappent tête, ils tombent, ils frappent tête, ou bien ils bat un coup de bâton baseball. Moun qui grand moun yo, plus souvent état mental yo altéré, c'est parce que yo kon gagné une infection. Par exemple, urinary tract infection, infection des voies urinaires, qu'on cause un pile patient vient l'hôpital là et leur fait test urine pour lui ou ouais que c'est infection des voies urinaires ou bien interaction médicamenteuse, altération du milieu de interaction, on me dit que la prend plusieurs médicaments à la fois, une a goût l'autre et puis causer que patient vienne gain altération de mental li. On dit accident vasculaire cérébral ou capable faire stroke surtout dans partie postérieure tête là, il pas jouer à monde donc sous gagne une occlusion ou capable gagner problème pour fonctionner. En tout cas, 10 à 25% grand monde qui est hospitalisé, c'est parce que ils ont ces problèmes de ce genre et ils ont développé des délire dans les premiers jours d'admission parce que ils pas ouais côté yo fâché. Donc ce qu'on pour faire, c'est pour prendre histoire là, c'est pour examiner, les fins fait test et puis pour décider soit voyer mon à la cassa ou bien soit traiter, soit kembel pour traiter. C'est très important. OK? Mais il y a une règle générale aux États-Unis qui demande pour admettre un patient suivant certaines règles, comme la règle de la Syncope de San Francisco, que si patient présenté dans l'hôpital là, et que dans le moment où il a fait triage là, il y a tension, il y a un gros numéro, un petit numéro, gros numéro a vient moins que 90, ou a besoin de 10, ça petit numéro a dit, gros numéro a ça le systolique là, il moins que 90. Ou bien patient dit il y a peine, il y a douleur dans l'estomac, chest pain, OK, ou bien il y a un antécédent cardiaque, ou bien et sang baissé, li anémie, très anémié, ou bien lecture et rythme cardiaque li pas bon, ou bien au fond blood gas pour li pas bon, bagay sa yo mérité pour patient admettre. Si rythme n'est pas normal, li pas sinusal, ou mérité admettre. Si il y a un nouveau changement sous EKG li, ou checker pension électrocardiogramme avant, ou garder ça ou un changement, admettre. OK? Donc, ou doit admettre patient ça. So, pas jouer à ça. Donc, c'est peut-être ça, là où on veut dans le cas là, où un grand monde, ou un petit monde, qui a un problème, ou doit aller mener un cas docteur, ou plus précisément, parfois même, c'est dans l'emergency room, suivant le cas. Donc, ça me permet nous connaître qui plus crucial dans la tête nous, c'est les gens qui ont perdu connaissance. Les gens qui ont perdu connaissance dans la tête médecin yo, dans la tête neurologue là, sont syncopies ou bien syncope ça, syncope ça en français, ou bien perdu connaissance ça, c'est ou bien ils sont bénis qui pas aucun problème, ou bien son bagage qui m'a adressé, ou bien la fait ligue épilepsie, trouble convulsif. Moi utilise le mot épilepsie, I didn't say that in English. There is a difference between epilepsy and seizure. Epilepsy means you've had more than one seizure of unknown cause. No precipitation of any causes, then you have 1, 2, 3 seizures. That means you have epilepsy. Epilepsy, elle dit que plus que un séjour sans que plus qu'on plus on crise, il ça. Mon donné m'a dit crise maladie ou gain crise ça ou gain plusieurs fois, plus d'une fois nous quello ou son patient épileptique. OK? Donc nous parlons de syncope. Si vous avez perte de connaissance momentanée qui va durer 1 minute, ou bien nausée, ou bien problème pour respirer, et ou men dès pour lever ou compte so côtoyer ou compte tout à faire. OK? Pas un épisode long en vont répondre. Ça très important. Très très important. Donc, il y a des facteurs spécifiques de l'épanouissement qui durent moins d'une minute. Pas oublier ça. Vous êtes capable de des mouvements saccadés, mais il va durer. Ou une perte de conscience, ou une vision tunnel, vision floue, ou une pupille dilatée, ou des étourdissements, ou des nausées, ou des sueurs froides, et puis ou une pâleur de la peau. Ça, c'est vraiment, c'est syncope, c'est syncope, c'est au perdu connaissance. Maintenant, nous parlons d'épilepsie ou bien de seizures. Si vous avez une histoire de qu'on fait crise déjà, donc nous connaissons assez épilepsie. Sous mode de langue ou pipi sous on fait numéro 2 sous l'on fait perdre connaissance pour plus que 5 minutes et puis l'on retourne ou confus ou à rendre côtoyer ou bien vont perdre connaissance là ou dit généralement me sens me centre ou me sens un côté ça le aura ça, ou confus là retourner eh bien ça m'a dit que au pré-traitement yo connaissez si joyer c'est épilepsie gain pour nous adresser ou bien des secousses inhabituelles rotation de la tête abouer tête ou mort de langue ça c'est spécifique qui montre qu'on a une crise pas oublier perte contrôle vessie et des intestins mordue de la langue convulsion mouvement involontaire claquement de lèvres ou baver yeux à droite à gauche ou regarder dans le vide à gare OK mais il y a syncope tout qui il y a syncope qui cardiaque généralement syncope cardiaque là les soudaines il va même bosser boum ou tomber et puis parfois même capable de répondre dans ce cas obligé aller mener patient caille docteur pour capable find out qui ça va passer. Bon bien aimé et m'étais content passer le ça avec nous. M'étais besoin parler nous de maladie que relé perdu connaissance. Quand pile haïtien, quand pile monde qui a perdu connaissance et puis mon monde qui dit moi yo dit moi cardiaque, yo dit moi cardiaque. Ou pas qu'à perdre connaissance toute la journée et pour cardiaque. Non. C'est pour un neurologue. Ou avec c'est venu mais un neurologue pour capable pour qui ça a perdu connaissance. Parce que épilepsie ou bien séjour, il y a plusieurs qualités épilepsie. Épilepsie il y a séjour généralisé, il y a qui partial, il y a qui complexe, il y a absence, il y a plusieurs types. Donc, l'on raconte neurologue là, ça gagne, lui-même est capable de catégoriser type séjour parce qu'il n'y a pas tout séjour et puis la crise qui a des mouvements incontrôlables. Non. Quel autre ou pas aucun mouvement incontrôlable. Que patient m'a traité pour séjour, c'est juste évidemment et puis il garde et puis that's it pour quelques secondes. That's it. OK? Donc, ça dépend de qui type de séjour. On va pas dire que, docteur a dit que j'ai 6 jours, même pas, j'ai perdu connaissance, ou même pas, j'ai comme. Non. Il y a un travail qui vous fait. Il y a pour faire 4 scans dans la tête, préférablement MRI, puis assurer qu'il n'y a pas de bagaille, pas de lésion dans la tête qui cause qu'on fait. Et c'est faire crise là, vous devez faire ça. Vous devez faire étudier vaisseau sanguin pour capable nourrir cerveau pour assurer pas de occlusion, il pas fermé, il pas bouché. Vous devez faire test sang pour vous, vous devez faire EKG électrocardiogramme pour vous, des choses préliminaires, des choses de base qui méritaient au fait pour qu'on connaisse exactement qui ça a causé qu'on a perdu connaissance. Si vous avez une question, comme nous toujours dit, vous êtes capable toujours écrire dans le chat là. Le chat là toujours vide. Nous avons personne écrit dans le chat. Le chat là toujours vide. Et un petit blague soit fait chat ça. fais chat là chaud, fais chat là chaud, fais chat là chaud. Et puis, quand il y a monde qui dit, Mami, est-ce que nous mangeons chat? Ou quoi adventiste nous y? Il y a tout le monde dit, fais chat là chaud, fais chat là chaud. Ce type n'a pas compris ça que les fait chat là chaud. Fais chat là chaud, veut dire, écrit en pile commentaire dans le chat là, CHAT, en français TCHAT, pour capable faire mon yo, mon cap qui gagne un programme, non, ouais qu'on intéressé, ouais qu'on fait commentaire, ouais qu'on gagne question. C'est un main que nous inscrivons, abonnez-nous sur le programme. Abonnez-nous pour Gospel Total Ministry dans YouTube ou bien dans Facebook, ça c'est une, et en même temps, nous partager le programme. Parce que ça nous dit, peut-être ou habitué, on a perdu connaissance, déjà on va connaître. Par exemple, depuis à l'enterrement, il tombe bip. Ça sont conditions qui méritaient adresser visite médicale, visite neurologique. Est-ce que nous comprenons? Il y a des fois, stress là trop pour mon nom. Il pas qu'à supporter lui, et puis, boum, il tombe. Et le cap comme mauvais saut, il n'y a pas de qu'on fait 6 jours, mais gros saut pendant tête, vient faire couler, il vient 6 jours. Vous comprenez? Par exemple, on qu'on habitué boire, il va te faire 6 jours, il va te faire crise, mais tellement prend son en tête, il vient faire crise. Donc, il y a plusieurs causes qui sont capables de causer que nous concerner. Donc, connaissance là, est bon pour apprendre, gagner, et c'est ça que Gospel Total Ministry veut faire, diffuser connaissance que si ça nous gagne, pour nous capables d'aider la communauté à identifier les crises. Je ne pas dire que toutes les fois on perd du connaissance, c'est crise ou gagne. Là, ça me dit du tout. Je ne pas dire que toutes les fois on perd du connaissance, c'est cœur qui va bon. Je ne pas dire ça du tout. Mais l'on perd du connaissance, on perd du connaissance une fois, on va dire, on va occuper de ça. On perd du connaissance 2 fois, on va occuper de ça. Non, on ne peut pas faire ça. Il est bon pour un cas docteur, puis on fait travail là, puis on fait tout devoir obligé de faire, pour assurer pas de cause qui explique comportement ça qu'a fait là. Pas oublier cerveau contrôler l'équilibre là depuis qu'on problème, il va recevoir sang assez. Depuis profusion sang moins que 30% notre cerveau il va recevoir oxygène, il va nourrir, la mandé pour la go à terre et les lago à terre pour équilibrer la refaite. Et si ce n'est pas un gros dommage, ou remonter, mais si c'est gros dommage, il est obligé d'adresser ça, et c'est à faire, il est obligé de faire test. Mes amis, ça a été un plaisir. Je vous souhaite vraiment gré. Vous avez été très gentils, et que Dieu vous bénisse tous. Je vous donne rendez-vous pour jeudi soir. Le rendez-vous, c'est jeudi soir, à partir de 7h, où nous aurons Shalom chez nous. D'ici là, portez-vous bien, que Dieu vous bénisse tous. Merci, m'espérez que vous êtes utile à prudent. Bye bye. Bye bye. Bye bye.